Hi everybody, my name is Dr. Mary Claire Haver. I'm a board certified obstetrician gynecologist. I'm also certified in culinary medicine, and I got asked a really awesome question today. What if there was any connection between menopause, libido, and nutrition? And I have great news for you because yes, the bedroom and the kitchen may be more related than we actually realized in the past. So in a nutshell, it's kind of sad that I believe it's 60 to 80% of peri to postmenopausal women will admit to having decreased libido and problems in the bedroom. And it's not like it's a one-size-fits-all answer for this. Libido in menopause is very, very complicated because there are several factors that could be leading to it. You know, there's emotional factors because for us as females, our libido is up here. It's almost 100% mental, the desire to have sex. And outside of that, things can suppress our desire. When we go through menopause, our estrogen levels decrease, okay? Estrogen does not give you desire, no. Okay, it's not a stimulatory hormone in that effect. But what it does do is keep your female organs healthy. It keeps the vagina, the vulva, and I'm going to use big medical terms here. I'm going to use real words. So if this offends you, I apologize, but I just feel like I've got this platform and this is such an awesome topic. So when we go through menopause, the blood flow to the female organs decreases because of the decreased estrogen. Also, the tissue becomes thinner, and the ability for those that part of the genitourinary tract stops making as much natural lubricant as possible. So we end up with thin tissue in the vagina, decreased lubrication, and decreased blood flow. All of that can lead to discomfort and pain. And so nobody wants to have sex, regardless of your relationship with your husband or how much you love him or how much you used to like to have sex with him. If it hurts, you don't want to do it. So that specifically is fixed with a conversation with your doctor. There is lubricants that you can try. It's pretty complicated. There's several different things out there, and you may be a good candidate for vaginal estrogen, which is much safer than the estrogen that is given in hormone replacement therapy in order to keep your blood levels of estrogen high. Vaginal estrogen is much, much safer. It's a micro percentage of the dose, just enough to keep the tissue safe and strong and willing to take on some of that onslaught so that you can relax and enjoy sex. So if that's not your problem, if you're like, I don't hurt down there, I'm fine. I have no libido. I don't know what's going on. You know, for those of us at this age, you know, in 25 years in OB-GYN, when you throw in the stress of juggling a job, parenting, marriage, you know, marriage that may have not have worked out, relationships, and our aging parents, you and siblings that may not have launched or also needing our help, you know, your libido will tend to fall down at the very long list of priorities in your life, and your libido requires as much attention as the rest of us do. So here's my premise for everything that I do here in the Galveston Diet. You should consider nutrition first before you take a pharmaceutical, outside of the vaginal dryness issue, okay? There's some definite topical stuff you can put on that's natural that will help with the lubrication, but nothing's going to work better than vaginal estrogen. Okay, so outside of that, outside of if you're not having pain, there are some awesome nutritional hacks that you can do to try to make sure that all systems are functioning. Remember, most of our libido is up here in our mind, supratentorial. If things aren't flowing well here, if your neurotransmitters are not optimal, if you have nerve conduction issues there because of poor nutrition. If, also there are nutritional hacks that you can do to increase the blood flow to the extremities. In order for you to have an orgasm, you have got to pump blood to the clitoral hood. It's very similar to the man's penis. It's an analogous organ in the woman. Ours is smaller, theirs is bigger, but it really is the same thing. With repeated stimulation in that area, the blood flows in, and then you have the release of the endorphins, and it's this wonderful, wonderful thing. So definitely before you run off to search for hormones to make this connection better, always try nutrition. My goal is to have all of you make sure that you are optimized nutritionally before you run out and get a pharmaceutical to try to change something. Because let me tell you, every single pharmaceutical out there is robbing Peter to pay Paul. I take medication. There are things that I absolutely have to take, but I try everything to maximize my nutrition so that I can limit the amount of pharmaceuticals, because everything has side effects. You're trading good for bad in little bits and pieces. Everything, you are just, it's better to try to nutritionally hack this than to go straight to a pharmaceutical. That's the last thing you try. Nutrition always first. Okay, nutrition and lifestyle changes. All right. So what are these things, Dr. Haver? Okay, all right. So let's talk about the kitchen and the bedroom and how they can be interconnected. So let's talk about things that will decrease your libido, okay? Either from an emotional standpoint or just from a biochemical standpoint. Studies have shown that a diet high in processed foods, fried foods, high sugars, refined grains, that's going to be your triple cheeseburger with side of fries and your soda, okay, high sugar soda, can sap your energy, lead to excess abdominal fat, weight gain, which promotes a negative self-image and kills desire. If we don't feel good about ourselves, if we feel bloated, if we feel gross and disgusting, because we ate something yucky and it's upsetting our tummy and it's making us feel like we have jelly belly, you are more than likely going to have decreased libido. I don't know why this doesn't happen to a man. I mean, they just seem to doesn't matter what kind of day they had, what they ate, if their tummy hurts or not, they're going to go. We are wired much more delicately. Just all the planets have to line up. So definitely, if you are filling your body with food that is hurting you, okay, if you're getting that triple cheeseburger, fries, and a Coke on a regular basis, you are not optimizing your nutrition. You are probably promoting excess abdominal weight gain. Your inflammation levels are off the chart, and you are crushing your libido. Inflammation, chronic inflammation, crushes libido. Okay, it's one of the biggest bad actor indicators out there. All right, so what are some good things about nutrition that you can turn that boat around? So in a nutshell, fats, healthy fats, okay? Not, when you have a good saturated to unsaturated fat ratio. Healthy fats, especially your essential fatty acids. So your polyunsaturated fatty acids and your monounsaturated fatty acids, and your omega-3s, especially. Filling up on the fatty fish, on your tuna, on your salmon, on eggs, on nuts, on seeds, chia seeds, flax, ground flax seeds. Good, healthy fats and oily fish are powerful, powerful, powerful anti-inflammatory agents. They are going to naturally lower your inflammation levels, which is going to start pulling some of that abdominal fat off, okay? And that is going to, from both a biophysical and an emotional, standpoint, decrease your inflammation levels and decrease the negative effects on your libido, raising your libido. So, other ways that you can decrease inflammation in your body. Remember, leafy green vegetables, your spinach, your kale, again, avoiding the processed foods, avoiding the excess sugars, avoiding the processed grains, especially for those of you who suffer from, arthritis, obesity, and, hormone imbalances, diabetes, and heart disease. All of that can contribute to your libido. All of those have an inflammation base. So just by the simple nutritional hacks of, the healthy fats, the leafy green vegetables, the broccoli, the kale, you can do a dramatic job substituting those for, don't shoot yourself in the foot, the processed carbohydrates, the heavy sugar loading beverages. Actually, I got my Topo Chico. Where's my Texas girls out there? This is free for me at the hospital, and I just drink it by the gallon. Hang on. This is a carbonated mineral beverage, and so delicious. It's got some lime in it. Okay, Other things, minerals. Get your blood rushing. Remember, in order for you to function down there in the girl parts, you've got to have the blood flow being able to go from a normal blood flow to an aroused blood flow, which is like causing vasodilation and shunting more blood into the vagina, into the clitoral hood, into all the female organs, so that you have the ability to orgasm. Yay. So vitamin C. I love berries. I'm a huge fan. Berries are packed with fiber. Berries are packed with micronutrients and anthocyanins, and they are highly, highly, highly anti-inflammatory, and they have lots of vitamin C. And so again, your leafy green, your broccoli, your kale, they're all rich in vitamin C as well. Also, zinc will also aid in blood flow. So that's going to be things like pumpkin seeds, pine nuts, red meat in moderation, chickpeas, and spinach. Also, you guys are going to love this. It's a little dark chocolate. So cocoa, which when I talk about dark chocolate, it's got to be at least 70% dark chocolate without any fillers, without any wax in it, without excess sugars. But if you enjoy dark chocolate, 1 ounce a night has a lot of zinc and a lot of phytonutrients, which will also help lower your inflammatory levels and give you a nice little nibble to go with it. Okay. Your B vitamins. B vitamins crush stress and boost your mood, okay? So foods that are rich in B vitamins, poultry, lean pork, whole grains, not processed grains, whole grains, eggs. Also, if you track your meal intake over the course of a week, if you are deficient in B vitamins, this is something that's super easy to supplement as well. So when your B vitamin levels are optimal, you are in like top condition form to combat stress, your lack of energy, or even depression. People who are B vitamin deficient struggle with those issues more than people who have them on board. So, vitamin D, there is so much more information coming out with vitamin D, and like almost everybody's getting their vitamin D levels checked at their annual visits and are shocked to see that their levels are low. I supplement with vitamin D every day, and I have the Galveston diet, omega-3 plus D, and so vitamin D is becoming the star vitamin, and it's a must-have for our overall health. So it's great for our immune system. It aids in the absorption of calcium, and it's great for blood pressure. It's even aids in cholesterol. So, but it also has been found to play a role in our sex drive. People who are vitamin D deficient their libido just doesn't seem to work as well as people who have enough on board. So definitely consider supplementing with vitamin D, especially in the winter months when you're not out in the sun as much. And during all this COVID craziness, when we were all inside, not going anywhere, not going in the sun, we're seeing decrease in vitamin D levels because we're not getting natural vitamin D through sunlight. Another thing to consider are your neurotransmitters. Remember, all of this has to be working to get your libido at its highest level. Remember, most of it comes from up here. If you're broken down there because the blood's not flowing, or you have low estrogen and it's hurting, that's fixable. But these nerves have got to be working. So neurotransmitters are the chemicals that signal between the nerves. So you've heard about them. They're used to treat depression. But serotonin, norepinephrine, I'll go through them here. So studies have been shown that foods, again, you're going to hear this over and over again, rich in antioxidants, rich in vitamin C, rich in folate, and also rich in the amino acid arginine, enhance endothelial function. So endothelium are the cells that line our blood vessels, and that is what allows blood flow to get to where it needs to go. Things like spinach, collard greens, lentils, kiwi, strawberries, mango, also loaded with folate and vitamin C. Chocolate, almonds, cashews, Brazil nuts, chicken, and beans. So dopamine is really important for our energy levels. Dopamine, the more omega-3 fatty acids that you eat, the better your dopamine levels are going to be. And so again, found in nuts, found in the fatty fish, salmon, tuna, sardines, and found in chia seeds and flax seeds. So Also, the amino acid tyrosine, which helps in the production of dopamine, is found in avocado, legumes, which are beans, and dairy as well. So tryptophan is really important for stress. And let's see, tryptophan is important. I have it on my notes here. We're almost done. Tryptophan is important for the production of serotonin. Okay, serotonin helps you feel calmer. Okay, and we can find tryptophan in brown rice and cottage cheese and sesame seeds and in peanuts. Spinach, collard greens, lentil, kiwi, strawberries. So we talked about all those. So also I was actually quoted in Shape Magazine talking about exercise. So exercise is huge in libido, and it turns out that you'll get a bigger bang for your buck by doing resistance training rather than straight cardio. So remember to work at least 2 rounds of resistance training into your workouts every week. Make sure you hit all the major muscle groups, because that is going to be one of the best ways to increase your libido. Why? Because after you work out, you have all these endorphins going. You feel so good. You get stronger. You get leaner. You feel better about yourself, and you want to hit the bedroom. So hopefully this was a fun talk for you guys. So there, and now pharmaceuticals. Okay, I mentioned estrogen before. Estrogen is great. It's not really to fix your actual libido. It's more to fix any problems that are broken down in the female organs. So if you're having vaginal dryness, pain, discomfort, go to your doctor, talk to them. You might be a great candidate for vaginal estrogen, which remember is a lot safer than the systemic estrogen we give you for hormone replacement therapy for hot flashes and the rest. There's also my good friend Cindy from Cindy Pink, CEO. She developed the female pink pill, the female libido pill called Addy, ADDYI. You can check it out online, and it has been shown to help improve libido in premenopausal women. So if you're not all the way through menopause, you might be a good candidate for this. It was just such a breakthrough for me to see something I could offer patients who had already tapped out their nutrition and done all the things and loved their husbands and really wanted to have sex with their husbands, and they couldn't. And this was something that would be helpful for them. So feel free to share this. Share. I love talking about this stuff. I am having to go answer some calls now, and I'm going to jump off, but we will chat again soon.